Hello, everybody, and welcome to Series 1 of Heading Home's first ever educational cafe, where we hope to provide you with the wealth of knowledge to feast on to hopefully inspire you to help with homelessness in your community or provide insights to frontline workers already doing this work on strategies that we use that may help you in your work. My name is David Cisneros, and I am the Emergency Housing Director for Heading Home's AOC campus. Now, I want to say I don't claim to be an expert. However, I do have 15 years of experience working with people experiencing homelessness. I am a native New Mexican and have a sincere passion for helping this population. I feel blessed to work for an organization that embraces the idea that homelessness can be solved and believes in a mission where we make instances of homelessness rare, short-lived, and non-recurring. I believe that we can achieve that goal together. So thank you for joining us today. We sincerely appreciate your support. Just a few housekeeping and agenda items. In today's cafe series, we will be discussing Heading Home's AOC campus programs, the Men's Emergency Shelter, and the Men's Respite Care program. And we'll also share some of the strategies we use to help our clients be successful, like I said before. I like to call our clients guests because that's how we treat them. It's the same reason why we say people experiencing homelessness, so we don't stigmatize this population. I find that we're more alike than we are different from each other. We will allow today's participants to type in questions at the end of the presentation. That will allow us to provide as much information as possible in the time that we have available today. I also want to thank the crew behind the scenes for their hard work to make this event happen. Thank you, Kim and Nick, and all the Heading Home staff. You guys are great. All right, let's get to the nitty-gritty good stuff. Heading Home's Albuquerque Opportunity Center is a services campus that co-locates two programs, the Emergency Overnight Housing Program, as well as the Respite Care program. The two programs share an outdoor garden, a computer lab, storage area, showers, laundry facilities, medical exam rooms, a library, and a classroom space. The AOC Emergency Shelter offers 56 beds in a safe environment away from the downtown area to any male over 18 experiencing homelessness. That is the only criteria. The program also offers case management and community supportive services. We also use the three-phase approach to case management, and we'll have a chance to talk a little bit about that later in the presentation. They can also store all their belongings with us without fear of losing anything. For example, they can store personal food items, medication, sensitive personal documents, and they can also receive mail at the shelter if needed. We strive to help people with the hardest struggles, such as active mental health or substance abuse issues, felony records or eviction problems, all the barriers that affect our population. Currently, about 35% of our AOC guests leave the shelter to permanent housing situations, which equates to about 20 to 25 guests per month. You know, it's very busy at our shelter at night, and I often see the staff helping guests settle in for the night, helping with laundry, or providing an extra blanket, and even sometimes giving out a homemade snack if we can get them. Our resident assistants and monitors are some of the busiest people that I know, and they always do their job with a smile, and Heading Home truly is a great place to work, and I hear that sentiment from the staff on many occasions. The AOC beds are given out on a first-come, first-served basis. We have a bed reservation hotline number people can call. Our service providers can send us a referral, which can be found on our website. And some key pieces of information that you guys might want to write down. Our bed reservation line number is 505-344-4340 and is open every day of the week. Our website is headinghome.org, and you can also email us at info@headinghome.org. The main office number is 505-344-2323, and I will ask our crew to put that information up if they're able to. And I'd like to spend a moment talking to you a little bit about a gentleman that we helped in our shelter when I was early in my career. And he was a young man. He had struggled quite a bit with relationships in his childhood with his parents and guardians. He had no alcohol or substance abuse problems, struggled quite a bit with anxiety, but his main issue was being able to find and maintain employment to help him be self-sufficient. As a result of being in our program for almost 90 days, we were actually able to help him identify some job resources, teach him a little bit of skills that he needed to interact with employers, and he was able to get a job within his first 30 days. He spent his next 30 days saving money for an apartment and was actually able to move out of our shelter into his own place. Now, the unique and most touching part for me was several months later. After a hard day at work, my family and I were having dinner at a local restaurant before COVID happened, when we could still go to restaurants. And we were sitting there having dinner, and a gentleman came up to me and tapped me on the shoulder. And he said, "David, do you remember me?" And I said, "Yeah, I think I do." And I remember him being a resident in the shelter. And he introduced me to his wife and his 2 young children. And in the time that he had been away from our shelter, he had maintained his employment and had built a family. And he said, "You know what, David, all I needed was someone to believe in me, and you provided that when I went to your shelter." And that was heartfelt and touching for me. And it came at a time when I feel like I needed it the most. And so these are the type of stories that we hear on many occasions out of our shelter at the AOC campus. And our hope is that we can continue to do that work for many, many years. Now I'd like to tell you a little bit about the Respite Care program that has 30 beds on the campus and offers 24-hour care to men who have been recently discharged from a hospital setting who don't have a home to rest and recuperate. The program is a more affordable option for hospitals and ensures people experiencing homelessness are stabilized through their recovery. The program offers safe medication handling, transportation to and from medical appointments, and maximizes aftercare efforts by connecting guests to needed care coordination and home health care services if needed. There is no time limit. Guests can stay as long as they need to recuperate and heal. An example of someone who we might have in the Respite Care program is someone whose diabetes is maybe out of control, or has pneumonia or a broken arm, things of that nature. We can help with acute medical conditions. However, respite is not meant to treat long-term or chronic health conditions. We allow respite guests to bring medical equipment or schedule home health visits, etc. And we also know that food is a big part of recovery, and our program also offers heart-healthy, diabetic-friendly meal options. In regard to respite outcomes, an average of 15 guests that enter the program leave to permanent housing per month. Now let's talk a little bit about what strategies we use to try and help our residents be successful, or our guests, I should say. I mentioned earlier that we offer case management services, and we try to do that in a way that does not overwhelm the guest. The three-phase approach, as we call it, allows us to start with the small stuff and work towards the bigger stuff. We try not to write the end of the story at the beginning. And what I mean by that is, even though permanent housing solutions is our focus, we don't start there. Phase 1 is all about increasing self-determination by providing resources, supports, and services that will help our guests be successful. That can include things like helping them get basic documentation like an ID or a birth certificate, or connecting them to primary care, which they may have never had before, allowing them to get bus passes for travel, or connecting them to free phones so they have a way to communicate. And then phase 2 is all about increasing skill level or income by providing employment resources, job leads, skills in interviewing, and how to write a resume, etc. We also try to offer some workshops and classes at the shelter that have been slightly put on hold because of COVID, but we hope to get back to those activities soon. But we can do resume writing, job search skills, and voc rehab services on a one-on-one level with our clients currently. We typically offer our guests a variety of weekly or nightly workshops on site, but because of COVID, like I mentioned earlier, we've tried to offer them solutions outside of the shelter, so we can make referrals to some of the other local resources that are still offering services of that nature. Now let's talk about phase 3. Phase 3 is about increasing residential stability by providing appropriate housing resources, helping our guests make a housing designation, and working through the barriers to achieving permanent housing. We realize that our folks not all are prepared to go into permanent housing independently, so some of our resources might include options for group homes or residential treatment for mental health or substance abuse problems, supportive housing that comes with case management on an ongoing basis, and some of our folks are ready to achieve market value housing, where they can go out into the community and pay market value for an apartment of their choice. Some of the ways that we help our folks achieve these goals is by ensuring that our shelter is what we call a low barrier model. We believe in the practice that the low barrier model dictates, which basically means that we want to try and take as many of the rules or barriers out of the way from our guests as we can. For example, we don't automatically discharge a guest who may have returned to a shelter in possession of alcohol, but rather offer him the option of disposing of his alcohol and staying in our shelter or taking his alcohol with him and leaving. The choice is up to him. We try to put the onus of behavior change on the guest, and this could also include using a behavioral contract to make a behavior change. We also believe in the housing first model, which basically means that we believe all people deserve the option to be in stable housing, regardless of their circumstances. People can begin to change their life for the better when they actually have a stable place to do so. Now, before we open it up to questions, I'd like to tell you a story about a Native American man who stayed in our shelter and is a good example of how the housing first model works. Native American gentleman came to our shelter many years ago as a result of being homeless for many, many years. His mother had passed away and he developed a drinking problem. The death of his mother affected him very deeply. Now, he was a relatively prominent artist here in our community before his mother passed away and before he developed a drinking problem. But after he began drinking, the things in his life started to fall apart, and he started to develop chronic medical conditions as a result of his drinking problem. He spent many, many times in and out of the hospital. The emergency services of Albuquerque were called for him on many occasions, and he actually created a rather large bill in the hospital system because he wasn't able to pay for his own care. The taxpayers in Mexico ended up paying for those bills. Now, by using the housing first model, when we first were introduced to this gentleman, we first placed him in permanent stable housing. And that allowed him the opportunity to begin to work on his substance abuse problems and to begin focusing on his medical care. Now, it's important to note that the medical costs caused by his frequent visits to the hospital setting were in excess of hundreds of thousands of dollars. And when we were able to place him in housing, we were able to determine that the expenses as a result of all those multiple hospital visits would have been enough money to provide housing for him for over 10 years. Now, the housing first model indicated, let's put him in housing first and work on the other situations later. So by doing so, we're able to actually connect him to resources for substance abuse problems, and he is now sober. And he's living in his own apartment and has been able to maintain his own permanent housing for over a year. And he's actually doing art again. And that's what we want to see. Those are the kind of outcomes we want to see for the people that we serve. So that when we drive to work each day, or we go about our business, and they pull up next to us at the stoplight and wave, we know that they're living their life the way that they want to under their own terms. And again, we want to try and provide those opportunities for the people experiencing homelessness of Albuquerque. So thank you for listening to me. And now we're going to open it up for some questions.
Thank you so much, David. I have a question in the Zoom chat. If I wanted to support the Albuquerque Opportunity Center, how would I best go about that?
Good question, and thank you for your support. If you'd like to support Heading Home, the easiest way to do that would go to our website at headinghome.org and look for volunteer opportunities and information about how you can donate to our cause. If that fails, you can call directly to our main office at 505-344-2323 and ask to speak to somebody who can help you with that.
All right, here's another one in the Zoom chat. Do guests have access to computers and internet at the AOC?
Absolutely. Now, computers are a big part of job search, interviewing skills, things of that nature. So we do have a computer lab that offers 9 stations for folks to go in from 8 a.m. until 10:30 p.m. every day to do job searches, write resumes, even listen to music, Facebook with their family and friends if they want to. So absolutely, that is made available to our residents 7 days a week.
From the same question asker in the Zoom chat, have you seen an increase in need due to COVID?
Absolutely, yes. We've seen an increase in need due to COVID. A lot of folks experiencing homelessness right now are worried and scared that they could contract COVID by being vulnerable out on the streets. Obviously, being out on the streets exposes you to more places that could potentially be infected, more people that you're not necessarily around on a regular basis. So by providing shelter for these folks, our intention is to ensure that they have a place to stay safe, can avoid exposure, practice social distancing measures, and hopefully avoid contracting COVID-19. But we've seen a little bit of an uptick in the increase for need for shelter services.
Awesome questions. Let's keep them coming, everybody in chat. I have another one. What specific volunteer needs does the AOC have?
Great question about volunteer needs. We find there are a lot of ways to become involved with Heading Home. Something that I want to mention is we sincerely try to find what our volunteers are most interested in. What are the skills and qualities that you have that Heading Home clients can benefit from the most? And so our intention would be to discuss that with you, determine what you're passionate about, and maybe identify some skills that you have that we can offer to our guests. But if we find that we're not able to make a match in that way, we certainly have a lot of other activities and opportunities for volunteers that we can share with you by either visiting our website and getting connected with our volunteer coordinator, or calling the main office and requesting to speak to our volunteer coordinator.
All right, another question from Zoom. Is there job search assistance available to the guests?
Great question. Yes, absolutely. Job search is a huge component of trying to identify appropriate employment. And as I said before, we try to offer workshops and classes to our residents so that they can learn how to do appropriate job search, again, learn how to write resumes, how to interact with employers. Because of COVID, we had to minimize the amount of group meetings that we can have in the shelter. So currently our case managers that work directly one-on-one with the shelter guests are identifying and informing them of employment resources such as job leads so that we can hopefully connect them to employment during their stay.
All right. Are there any criteria that a person must meet to volunteer?
So in order to meet criteria to be a volunteer, you can't be an axe murderer. Just kidding. There really is no criteria other than that you're passionate about helping others. And by having a discussion with our volunteer coordinator, we can identify how we can best use you in our organization. So that means that children want to come in and volunteer. Oops, sorry. I just wanted to add to that last question. If folks have, a family that wants to come and volunteer at the shelter, I wanted to make sure people understood that they could bring children, for example, to serve a meal at the shelter, but they would have to be accompanied by their guardians or parents, someone over 18 that can keep an eye on them while they're there in the shelter setting.
Another question from the Zoom comments. How do guests get to the AOC? Do they walk onto the campus?
Good question. So part of what we try to accomplish with our shelter is minimizing the impact to the neighborhood around us. When we first tried to establish our shelter, like in many cases, there's going to be some pushback from the community. And our ultimate goal was to try and accommodate everybody, not only the guests that we serve, but the surrounding businesses and residents of that community. So what we were able to come up with is we don't allow our residents to walk onto our property. That keeps them from milling around outside of the property after we close or before we open. So all of our guests are transported directly to the facility from a day shelter location that offers day services. So every morning we drop our residents off at 6 a.m. at a location where they can get provided a breakfast meal. And every evening we pick them up at the same location at 6 p.m. so that they have an opportunity to eat an evening dinner meal before they come back to the shelter. And I mention that because our shelter tries not to duplicate services that are already being offered in the community. So because there are a multitude of meal providing sites, we make sure that they can get to those locations so that they can have access to those meals. Now I do also want to add to that question, if a resident has their own vehicle, They can drive themselves to the shelter. As long as they're not walking to the property, they're safe to do so.
Another question is, what do the guests do during the day when they leave the shelter?
Good question. So because we are funded as an emergency overnight shelter, we're not allowed to keep our guests in the shelter during the day. So our hope is that they're going out during the day to achieve the goals that we've set up for them through our case management services. For example, you might have to go to the DMV to pick up a replacement ID, or go to the Social Security office to apply for a replacement card, or go search out some job leads that we've talked about the night before. So our hope is that they're going out and taking care of business, following up on healthcare, things of that nature. But ultimately, they can go out and do what they want for the day because that time is theirs. Again, our hope is that they're focused on their goals and working towards those goals, but ultimately they have the freedom to do whatever they wish during the day.
A question in the Zoom chat asks, can you talk a little bit about the other wings in the AOC outside of respite and what those are like?
Sure, great question. So we're talking about special wings outside of respite care or the AOC main dorm. So just to put it into context, our AOC emergency shelter has a 56-bed dorm. All those beds are in the same area in a dormitory style setting. We also have a separate wing for respite care that has 20 beds separated for folks discharging from a hospital. We have a special wing called S wing for additional beds that allow us to provide beds for overflow respite care patients, but at the same time allows us to do some pretty creative options in our emergency shelter. So for example, because we're funded as an emergency overnight shelter, we're not allowed to have guests stay during the day. However, we've created an overnight employment program. What we want to provide for our guests is sometimes we have folks that work overnight. Being in our overnight shelter, they have to make a choice between having a place to stay or maintaining their employment. We don't want them to have to make that tough choice. So someone who's working in the evening hours overnight has the option to provide a copy of their schedule to us. We'll sign them up for the overnight employment program, and they can leave during the overnight hours to work and come back during the day to sleep. The S-Wing also provides us with an opportunity to put folks who maybe have difficulty sleeping in the main dormitory area. For example, someone with medical equipment, a CPAP machine, something of that nature, an oxygen concentrator, or maybe they have night terrors, or they snore a little bit loudly. We can put folks into that special wing, and that separates them a little bit from the main population and allows them to work through some of those barriers a little bit easier.
All right, we have time for a couple more questions. If you have a question you want to get in, go ahead and enter it in the chat. We're going to move on to the question in chat now. Are there medical staff?
Good question. So we don't actually have a medical staff at AOC. However, we have volunteers that do come in and volunteer their time, and we work very closely with care coordination. So specifically for our respite care program, the staff does not provide any medical procedures there at the facility. For example, we won't help them do venipunctures or do any assistance with adult daily living skills. Of course, that does happen from time to time, and the staff is happy to accommodate. But again, it's important to remember that if someone needs a higher level of care, meaning they can't bathe themselves, they can't feed themselves, they can't transition out of bed to a wheelchair, things of that nature, they should be provided a higher level of care. And we're going to ensure that those clients that come to us in that situation are provided an opportunity to get that higher level of care. So that's typically how we handle those situations.
Alrighty, and then our last question here is, how many individuals does the AOC help per year?
Hold on. AOC emergency shelter, sorry, good question. So the AOC helps an average of 690 to 1,000 residents per year. We're averaging about 750 right now. And in the respite care program, we average about 300 to 400 residents per year. And again, like I said, an average of 25 to 35% of the residents that come to the shelter setting are leaving the permanent housing options.
Great.
Okay. All right. Well, I want to say thank you for everyone who joined us today. I hope that you found this information useful. I appreciate you listening to me, and I want to encourage you to get involved in helping people experiencing homelessness, regardless of what that looks like, whether that's with Heading Home or one of our sister organizations. We would sincerely like to see your happy face helping us achieve the goal of ending homelessness in Albuquerque. Don't forget, if you need additional information, you can visit our website at headinghome.org, or you can email us at info@headinghome.org. It's been a pleasure to be with you today, and I hope that you found this information useful. Take care now.